So I think we did pretty well covering the questions you would ask an entrepreneur about. Here we have Magaly. Well, on time. Thank you very much for joining us, Magaly. We were just wrapping up the previous case study. Can we?
Yeah, because you don't have camera.
Okay. Okay. Now you're back. We can see you, Magaly. Can you see us?
Yes, I can see you. Thank you for the invitation, by the way.
Okay. No, very welcome, Magaly. I hope you see the class, and it's great to have you back. And I said to students in advance that you would start with sharing, well, introducing yourself, Magaly, and then sharing the work you've been doing with Mamás del Río. And as we did last year, Magaly, maybe towards the end, sort of we can brainstorm a bit how we could make your solution financially sustainable. And I'm sure you may have updates on the funding front in between last year and now, but I'll leave it over to you now to start the session, Magaly.
Thank you very much for the invitation, and I am very happy to be presenting today about our work in Mamás del Río. So let me show you some slides. I understand I have 45 minutes for the presentation and then 15 minutes for questions. So there has been some updates regarding my presentation last year. As I mentioned, Mamás del Río was a program that first aimed to improve maternal and child health, but now has expanded from this area to a more comprehensive health, empowerment, and also advocacy in the Amazon. So now we have created an NGO called ICARA, so we are operating under two umbrellas, Cayetano Heredia University and also our NGO. So I want to explain you first why we decided to start on maternal and child health. And it's because there are 4 times more newborn deaths and 2 times more maternal mortality in rural areas in the Amazon than in the rest of the country. And this is because these communities live in remote areas. So it's important for you to understand the context. No? They don't have access to water, electricity, or sanitation. If they want to reach to a healthcare facility, many times they have to travel hours by river to get to the nearest health center. And when they actually reach to the health center, basically it has almost no medicines to manage any emergency. So they don't have a very good resolution for these cases. Okay. So why I decided to work on maternal and child health in the Amazon? I don't know if you see my slides. Let me upload them again. So the reason is that I experienced my maternity in the Amazon while doing traditional research. And then when I experienced being a mother there, and I realized that you don't have access to anything, no good prenatal control. Sometimes they cannot even measure your blood pressure. I decided to switch my work towards improving the health of women and children in the Amazon. That's why we actually started our work. And we got funding from Grand Challenges Canada and the Peruvian Council of Science and Technology. And as you know, in research, it's not that there is a magical wand that gives you the money for the project you want to do. You have to apply. In our case, for a Spanish-speaking community, we have to learn how to speak in English, to write in English so that we can get funding. And actually, all the experience of how I created the program is in this paper about my path to be Mothers of the River program. And this has been our journey. So we started first, and this is an important recommendation, with formative research. Then this is important to understand the cultural aspects, for example, of a pregnancy, of a delivery, and of the care of the newborn. Then we conducted the intervention design, implementation, and evaluation of our intervention that we published in the Lancet Regional Health Americas. Then we expanded the program to Colombia in 2 phases, facing much complex problems like the guerrillas, the cartels that are present in the border with Colombia that is full of coca. We have also worked on community empowerment besides the research because, and this is an important tip, no? When you're a researcher, they told you that you have to test a hypothesis and you have to publish. But if you want to be, or to have a sustainable intervention, actually you have to empower the community so that they can solve their own problems. This is something that we have done in Mamás del Río, but once we finish the intervention, we continue to do it. We have also done research on mental health in indigenous women to understand mental health, work on the prevention of adolescent pregnancy, political advocacy, and now I also have, I host a TV segment on Channel 7 in Peru called Science That Builds, with the purpose of translating science into public action. So I want to mention something about formative research. We first went to live on the communities, conducted 60 semi-structured interviews, where we found out that the majority of deliveries occur at home. That's why our main objective in the evaluation is to improve essential newborn care in home deliveries, and there was any trained care provider present at the delivery. No? We found out that the deliveries occur at home with poor essential newborn care practices, and the godmother, who is the person that you choose before the delivery, who cuts the umbilical cord, was a person super important, because if you die during your pregnancy, she will be in charge of your daughter or son. And if you don't die, she will be in charge of you. She will feed you, she will clean your home. So the godmother is important, and that's why she is in every educational material that we have in Mamás del Río. Also, we did a research about the use of technology in community health workers, and we prove that they are able and willing to use technology, because at the beginning, when I designed the intervention, they told me, Magaly, but why are you giving cell phones if they have low literacy and that there is no connection? But we proved that no, that actually they are super willing and able to use technology. And we tested this intervention in 13 communities along the Parinari district in Loreto. So I want to mention the program components. So what does MDRs of Mamás del Río, which means Mother of the River operation, look like on the ground? So we have a community component with community health workers doing home visits to pregnant women and newborns. This is something that we haven't invented. There are tons of research saying that community health workers can save lives. We also train traditional birth attendants on essential newborn care. Traditional birth attendants are forgotten in Peru. They are afraid of training them because of the fear of the Ministry of Health that if you train a traditional birth attendant, you will increase home delivery, which we prove in our publication in Lancet that actually is not true. Actually, if you involve them, you decrease home delivery and improve institutional delivery. We also conduct community sensibilization, because the person who decides is not you as a woman. So if I am bleeding in a community and I want to go to a health post, if my husband tells me that I cannot go, I cannot go. Or if the leader of the community makes a decision that I will not go, when I will not go. That's why it's important to include all the community in the program. And we also do the training of health facilities. We do sensibilization to the healthcare workers of the importance of community health workers. Community health workers, by the way, are lay people from the community that are choosing in an assembly to provide and to seek, promote health in the community. So that's why it's important. And we also train the health facilities on essential newborn care, all supported with a supervision component. So we created a community health program, health worker program, strengthened with an app for tablets. And you can see here Regner doing a home visit with his tablet to a woman who already delivered her baby. And this is an example of how they conduct the home visits. And we also train traditional birth attendants and healthcare personnel. And this is us in the field, and that's training to the community health workers. It's a very interactive training, by the way. So community health workers identify pregnant women, and this is important because in the capital or where you are now, or I am in Lima now, well, I go to the pharmacy if I suspect that I am pregnant and I get a pregnancy test. But in remote communities, they don't have access to pregnancy tests. They have to travel for a lot of hours, and sometimes in the health post, they even don't have pregnancy tests. So that's why it's important to put the pregnancy test in the hands of community health workers that are persons who live in the community, and they can conduct these home tests so that they can refer early to the woman to the prenatal control. And then they conduct home visits, 3 during pregnancy, 8 after delivery, with several tools. They have an mHealth application, birth and emergency health plans, pregnancy tests, and clean delivery kits. I won't go into detail of all the home visits, but I want to mention that each visit in the tablet has key messages. Like, for example, promote birth in a health facility and early antenatal care, or prepare birth and emergency plans in the first visit. And each visit has a main message. For example, in the last visits, which is before the delivery, they have to promote newborn care practices, like exclusive breastfeeding, delayed bathing, clean core care, and promote postnatal care attendance on first day. And we have measured all of this in our evaluation. So regarding the educational material, I wanted to highlight the digital stories to promote behavior change. So these digital stories are, that you can see here in the tablet, are stories that have been created by the community health workers or pregnant women who want to tell a story of something that was super challenging to them. Sometimes are stories where people died, their relatives, because they didn't do something. And these stories have been very powerful. In the evaluation, when we measure if they remember the stories after 3 years, they can tell you the story of Carla or the story of Celia. We use for this photo voice and storytelling, and this was super, super powerful, and we continue to use it in other studies that we have. And this is the reference if you want to see them. Also, we have video with community influencers. So the videos are not me, a medical doctor in Lima, explaining them how to deliver a baby. It's a Teresa Fasabi, a traditional birth attendant from a community in Parinari, that explains how should they care for their newborns or during the pregnancy. So these also are very, very important stories that they relate to. Regarding the program evaluation, we did the intervention evaluation in 84 communities. It's very challenging, it's not easy. You have to deploy the intervention, to remote areas and do the evaluation, which is also something challenging. So we work in 3 districts along 3 rivers, Marañón, Ucayali, and Amazonas, with a total extension of 350 kilometers by river. This was our primary research question, and the question was, if a combined community-based community health worker home visit intervention plus facility strengthening be feasible implemented, achieve high intensity, and reduce coverage gaps of essential newborn care and healthcare seeking in rural Amazonian Peru. So this was based, and actually this research was the PhD thesis of Stefan Reinders from the London School of Hygiene and Tropical Medicine, who successfully already graduated from that excellent university. And we have 2 objectives. One was to conduct a before and after study to assess changes in essential newborn care with yearly censuses. And the objective 2 was to conduct a mixed method process evaluation. So for this evaluation, we will visit all women who had a live birth in the last 12 months. We measured the primary outcomes that were at home deliveries and also secondary outcomes. We did a household listing of all members of the household questionnaire using cell phones, and we have 3 teams that visited all the 84 communities every year. Our team is basically full of females, and this is one of the main slides I want to tell you, and this is important for the evaluation. So what we prove is that Mamás del Río is able to improve almost all essential newborn care outcomes regarding thermal care, breastfeeding practices, and core care. One of the things that we find out in the formative phase is that women, for example, throw out the colostrum, which is this first milk that comes out after the delivery, because it was yellow, and through generations, the message was passed that this was damaging for the child. But if you see, for example, the colostrum feeding, it went from 40% to more than 80%, and so the other ones. The other important finding, besides improving on essential newborn care, was that we increased institutional delivery, which was something that we didn't plan for, because we thought this is complex to achieve because it doesn't depend, improving of the healthcare post doesn't depend on us from the government, but it increased. And also it increased the visit that women do after delivery to the health post. And you can find the evaluation, and they send you actually this paper here, no, in the Lancet Regional Health Americas. Then we scaled the program to Colombia, and this was a call from the Ministry of External Affairs, who told us that they want some improving of health in the border with Colombia. The border with Colombia is super complex, no? I don't recommend you to travel there for tourism, because there is a lot of violence from the guerrillas, las Fuerzas Armadas Revolucionarias de Colombia. There we have 3 cartels there, but that means that it's important to doing health interventions there. So we have a lot of support from several entities of the government. This is when we launched the second phase of the program. We had 2 phases already. So we went from here to here, no? In the border of Colombia, in the Putumayo River, into 30 communities. So we work in 2 areas, Puerto Leguízamo in Colombia and Soplín Vargas in Peru, and El Encanto San Rafael in Colombia and San Antonio del Estrecho in Peru, super far away, 12 hours with a 200 horsepower speedboat. So this is very remote. And we trained, this was the first training in Peru and Colombia during the pandemic. This is a house called the Tambo, which is from the Ministry of Development and Social Inclusion, that is in the middle of the Amazon, designed for rural areas. And this was the traditional house in Colombia, called La Maloca. So Mamás del Río adapted to the Colombian health system. For example, in Colombia, abortion is allowed. In Peru, no. So we have to move the first visit to the second one. And so there were other adaptations. Also, community health workers in Colombia were all women. We also learned from Colombia a lot. Even though we gave the intervention, we learned a lot from their team of how to choose community health workers. And I learned a lot the importance of having the gender of the anthropologist, that I can explain you later. But it's important also the gender of the researcher or the innovator, if you want to achieve a specific objective. So in this program, we have new components. We extended the number of visits. We also include a section of community surveillance for the identification of cases of violence against women and children, the promotion of access to contraceptive methods, and also the promotion of access to a medical ship that is huge, that brings several services to rural areas in the Peruvian government. And before Mamás de la Frontera, there wasn't a bridge between the community and the ship. No? Now there is the community health worker who is the bridge. These are some of the newborns born in Mamás de la Frontera, at home or in their houses. So as I mentioned you at the beginning, Mamás del Río evolved into a platform that actively advances Amazonian, indigenous, and rural health. So we didn't stay only with maternal and child health, and I want to tell you why. Of course, I was very sensitive because of my pregnancy, and I wanted to improve the health of pregnant women. But I found out women 10-year-old, like children, 10-year-old who were pregnant, or 15-year-old with her 3rd pregnancy. So I said, I remember in the first visit, we told them, congratulations, you're pregnant. But how can I say that? No, maybe, so this was super important for me to realize. And I said, okay, we need to expand our program to other areas. Also, we found out children without an identification card, something as basic as an ID that you have and give you access to several governmental services, free health, free education in Peru, that don't have an ID. So there were much more things to improve, and that's why we have expanded. In Mamás de la Frontera, for example, community health workers advocate for people who have to have their ID and also to have access to a social program called Juntos. That is a program from the government who give you cash, 100 soles, $30 per month to families in extreme poverty. So we expanded our work to the prevention of adolescent pregnancy, mental health, community empowerment, also political advocacy. And I want to mention briefly some of these studies that we have done with research from the National Institute of Health program called the Launch Program from the Fogarty NIH. So this has been the work of Lisa Woodson, who has worked with us for the last 4 years. So Lisa went to the communities to understand why adolescent pregnancy happened. If you want to read more about the research, she has 3 publications so far explaining this. And also, she designed an intervention called Wikan Kunumi, that means empowering youth. And this is the visit that they done in the Australia embassy, who provided funds for the design of the intervention that was done and explained by youth community health workers with older community health workers. And this was a very important project, not only to design how we can prevention adolescent pregnancy, but also to empower youth. And now we're looking for funding for the implementation. And one of the news is that I have, because Bruno brought up this at the beginning of the meeting, is foundations, basically, and donations. So the second project that I want to mention is the work by Dr. Miranda Harris Martinez. She studied the expressions of depression and anxiety among indigenous women using a technique called body map. So in this study, women lie down on a piece of fabric and somebody outlined the body, and then they draw in which part of their body hurts when they feel emotionally stressed. That they, by the way, don't call depression and anxiety. So those words doesn't exist in indigenous contexts. So if we don't understand what are the expressions of emotional distress, how we can solve these problems or help them to solve this problem. So they draw these body maps, and also they draw how they can overcome this, which is, for example, to go into the fields, to go to their chakras, to harvest. And the way she gave back the results to the community is by taking the draws to all the communities where the woman came from and participated. And this was also an important moment for women to share their interests, their knowledge, their experiences, and create a community of empowered women. Also, I want to mention the work of Tina Samsanchariat. The work is, the project was called Listen to My Voice, or Escuchen Mi Voz. And this was an important project also conducted through Photo Voice, where Tina made them realize how important were they during the COVID pandemic. So they took pictures of their work, pictures of what they feel they lacked during the pandemic, and they presented this work in the regional government of Loreto, and also their pictures were presented in the Ministry of Health of Lima. After this, and I don't mention a causal effect situation, but they created the first indigenous association of community health workers in Loreto called ACOSIL. Now we have been conducting trainings for empowerment. They have created a logo for ACOSIL. We send them the t-shirts. And this is a thank you note that they sent us. They took this picture and they sent it through WhatsApp because of the help and support with the t-shirts and the logo that we did. So here says, gracias a todo el equipo de Mamás del Río. So thank you to all the team of Mamás del Río. So our program has generated scientific evidence of its effectiveness. We can tell every piece of every story of their work. I make sure that all of what we do is based on scientific evidence, and it has a research paper behind. We received several awards in Peru. In Washington, D.C., we received the Social Innovation in Health Award by the hands of the head of the Pan American Health Organization in Washington. Also in Peru, from the Minister of Health to the municipalities that implemented the program. I presented in Geneva about social innovations in health. Our program was selected as an example of this. However, all of the work, and that was a hard learning. Even though you conduct research, you prove that it's effective. It's well received with the communities, and even politicians say that it's a good program. That doesn't mean that they will find you and adopt your program, or that your program will become a public policy. So I realized this, and I decided I have to move from this space to a new one. So that's why I decided to enter into the work of politics. First, applying in the elections of the Medical College of Peru, which I work now. I am the head of political advocacy in medicine and public health. So our area is in charge, for example, of reviewing all the bills sent by the Congress related to health. I have to give opinions. We have to do statements. We can ask many things, like, for example, that the Minister of Health resigns. So we do many things. We won the elections, by the way. And for example, related to the work of community health workers, this was the first gathering that we did after we were elected in the Peruvian College of Physicians with 1,000 community health workers from all Peru. This was impossible for me to do from the academic space because I didn't have the funding. Actually, we as the Peruvian Medical College, we didn't fund this, but we give the space for the Minister of Health, and he is the former Minister of Health, to host this event. And there I met Carmen Vilela, she, from the Red de Promotoras de Salud de Lima y Callao, and one of the things that we're trying to do is change the law for community health workers. And we needed to change this law because by law, community health workers are volunteers, so they don't receive any incentive. So you are making people from rural areas of Peru working for free. People who don't have access to water, electricity, sanitation, they don't receive a salary, but you are making them work for free. And this is something that we want to change. And one of the reasons that we operate in Lima is because in Lima, we have the institutions who can do these changes. So we went with her to a presentation. So in this example, I gave a scientific presentation to a congresswoman who was interested in presenting a bill to change the law for community health workers, who was the Congresswoman Bazan. She finally met with us. We had a board. We improved the bill that she sent us. She presented the bill, that is this one. We did a policy brief. Then we went to do a meeting at the Congress with some organizations that work on community health workers, at the university also with several community health workers to receive feedback about the law. When we talked to a second Congresswoman, Ruth Luque, she also presented a bill. And a third one, the Congressman Bustamante, who is from a different political party, and we had the third bill for community health workers. The bill was approved by the Health Commission. Now we're awaiting their approval by the Budgetary Commission. And we have done political advocacy with the community health workers with several Congress people in the Congress in Peru. We also went to talk with the Minister of Health, with this Congresswoman, and we realized that it doesn't matter that we have several bills. I mean, we have until July to get the approval of the bill. But if we, again, don't empower the community, if the bill doesn't pass, nothing will happen. So we need to create a network of national community health workers. So besides ACOSIL, which was the Association of Community Health Workers in Loreto, we started to identify networks of community health workers throughout Peru with Carmen, who has been traveling in Peru doing this work. And we have done Zoom meetings to tell them about the law and to tell them to be included in this national network that we want to create. So this was one of the meetings that we have. And this is our slogan. Los agentes comunitarios de salud salvan vidas, apoyemos la ley que los protege. We did this in the front of the Congress, and means community health workers save lives, let's support the law that protects them. And this was a very important event and also empowering event for the community health workers. So finally, before I end my presentation, I want to show this new area in which I am. I told you my research experience with Mamás del Río, trying to advance the knowledge that we have on indigenous Amazonian rural health, and also my work on political advocacy, which is super important. If you want to influence policy, there is no way. You have to do political advocacy and get to the people who make decisions. And this is the third area in which I am now, and trying to bridge the gap between evidence and the public. So I am the creator and presenter of a TV segment called Ciencia que Construye, or Science That Builds. We broadcast on Channel 7, which is the Peru's state-run network, which gives us the largest reach in the country. It's not the most popular, but has the largest reach. And this allows us to bring health education and evidence-based advocacy to the most remote and vulnerable communities. So our goal is to bridge the gap, no, between science, policy, and the citizen. And I have done already 13 segments. I want to mention, because we still have time, I want to mention 3 of them. No? One is this, which is exposing regulatory holes in nutrition. So Peru is known for implementing octógonos, which are these black warning levels on processed foods high in sugar, sodium, and saturated fats. However, I use this segment to expose a critical gap. So these warnings are currently not required on infant formulas or on packaging smaller than 50 square centimeters. I just returned from Buenos Aires, Argentina, and they have these packages super small, like candies with octagons. So it's impossible that we cannot do that in Peru. So we brought this to national television to advocate for comprehensive regulations that can protect our children. So this was a very important segment. So this was another segment that I want to mention about. You know that there was a massive wave of emotion among the large Venezuelan diaspora in Lima following the geopolitical shift of Trump defeating Maduro. I'm sure you saw that in the news. So instead of entering into the political polarization, we are a segment strictly on the science of hope. So we focus entirely on the psychological and neurobiological mechanisms of resilience. And we provided scientific grounding to a highly emotional social climate that we were experiencing in Peru. I'm sure in several parts of the world. This was an important segment for the importance of women in science. It's, you know, on February 11th. So we use this segment to advocate for more women and girls in science, which is also important for me. And this was a super complex segment. I received the most, a lot of support, but also a lot of hate comments with this, no? And this was because a conservative congresswoman recently boasted in the media about running a shelter full of pregnant children, dangerously normalizing child pregnancy. So I responded immediately. We dedicated our segment to the devastating psychological and psychological consequences of pregnancy in girls under 15. Here in this segment, I use medical evidence to remind the public and policymakers that in Peru, therapeutic abortion is legal since more than 100 years ago. And in these cases, it's a necessary medical intervention to save lives. So this was, I will say, an important segment. And this space that I have now helps me and allows me to put some topics in agenda. And here, one of the important things is that we are providing evidence that science shouldn't remain locked in journals. So it must be on national television, defending human rights, holding policymakers accountable, and also building a healthier society. So this was my last slide. I did it on time. Remember, I was traveling with my children when she was 6 months old. Now she is 14 years old, and she still goes with me to the Amazon. So thank you very much.
You, Magaly, such an inspiring story. I'm sure the students will notice that you've done state-of-the-art research as we try to teach here, but also took it to the policy level with the policy briefs, which we're trying to do here, and also do the public engagement, which is terrific to see and the impact it has. Can I kick off with, because we discussed it last year, tell us a bit about who's currently funding the project. It started with the Grand Challenges Canada and some other funding. Who's now paying for the service? And
Yes.
is that sustainable?
Yeah. So the main grant ended, and now we have a foundation, and we have these projects, no, in some of the communities, but we don't have the fully implemented project again. We have the and we, as I mentioned, tried for the government to take the program, which is impossible. So what we have is a foundation committed in funding the training. Actually, we already received the funding for the first training of community health workers. So what I can say is that if you don't have grants, foundations, or donors, or angel donors, actually, it's one angel donor, will fund the training of the community health workers. Because after the full grant ended, we have done, as I mentioned, these specific projects, community empowerment, but not in the 84 communities, no, in some of the communities. But we have the commitment of a foundation and an angel donor to fund the program. No? We have received a little bit of funding already to university, and they have committed to fund yearly the program.
Okay. Let me.
By the way, I didn't mention that we have expanded the program also to other parts of Peru with an enterprise. No? It's a construction enterprise who want us to implement the program in almost in Lambayeque. So we are also there. I didn't mention that, but yeah, there is a company. Not in the areas of Mamás.
Social enterprise. What does a social enterprise do?
No, it's a construction company.
Okay. And they pay for part of the program then, or?
They pay for the program in the areas where they operate. Yeah, not
okay.
in Loreto.
Okay. Any questions you have?
Hi, Magaly. I had a great time listening to your presentation. And I've worked in that space for like 2 years. And I'm just wondering, just to follow up on what Bruno was asking, you mentioned that you're receiving like grants from donors and everything. But I've also worked in a space where at some point you want sustainability. So what's like the future looking for you in the next 5, 10 years? Because when these donors give the money, sometimes they give you money for like 5 years, 10 years, but at some point the money will be up. So like, what are the plans, especially because you did, initially I was thinking that you were like trying to integrate it in the primary healthcare system, but you did mention that you try advocating on the government side and it's not like progressing. So what are your plans going forward?
So I try to implement a business model, cost reduction, cross-selling. It's difficult to operate in rural areas because women and children, they cannot pay anything. So we cannot ask them to cover any services like we can do in Lima. So for me, the main way is to make it a public policy. And one of the things that I will do is to enter more in deep in the world of politics, basically. Because that's I think for rural areas is the only way that you can do that. No? And because grants will end, donors, although he has told us that he won't leave us, who knows? But for me, in these areas, it has to be the government. And plus, you have to empower the community. So if the government changes and they decide to stop the program, the communities are empowered enough to not allow to happen this.
Would you remind me if a pregnant woman needs to be referred to a hospital? Does that happen, and if so, describe how the referral works and who pays for the transport and the services in the hospital?
Yeah, a pregnant woman has to be sent to the hospital. Usually, the helpers should pay for that transportation, but they don't do it. So what we have been encouraging in some communities is that they create like a pot of money that they can use when they need these emergency deployments to women.
And once in the hospital, who pays the bill? Is it the government?
Okay. See, communities have something that is called Seguro Integral de Salud, which is free for the government. However, it's not perfect. Yeah, but care is free.
It is free once they reach the hospital.
Yes, that's correct. It's free when they reach the hospital.
Okay, it's just a follow-up. It might be helpful at some point. So I've also been working like indigenous communities, like in the Philippines, kind of similar setting. They're very rural. So we thought about like having livelihood as part. Like you said, some of them cannot pay. They have no access to ID and all of that. But we noticed that if, for example, they come together, cooperative development, they come together and have the idea of the pot that you mentioned, they come together and they come up with like a business or something that like sells in the area or stuff. That way they are able to like raise some money and keep on the side in case like emergencies like that happen. And now it's like really progressing, at least until maybe the Filipino government is able to do something about it. But in the meantime, I think it's helpful to think about ways of empowering them in terms of livelihood and not just like focusing on health. Because at some point, we spoke about aging this morning. Time will evolve and you get into politics, it's going to take time. But I think one way of doing, like you said, is empowering them and maybe like helping them find sources of like livelihood and saving the money in a way that might just help them at some point in time, even if you are not there.
Yeah, thank you for your comment. We have provided funding to some community health workers to make uses, for example, and they gave us the idea of a machine to use, but yeah, it's something very initial.
Any other questions or ideas?
And while you have an idea, I would love to have a picture with you and me, maybe from the corner, if you can, just while we are answering questions.
Oh,
No, just like why this thing.
which stand or
Take the picture why we
want the picture?
Okay, yeah.
Can she see you? Can she see us?
So I don't know if, for example, it's a question for you, if you have considered entering into the work of political advocacy.
I have.
What do you
Right.
mean by political advocacy?
So being political active, because I think it's the way to make things sustainable sometimes. So not only for me, being a researcher is like being in a bubble. No, now that I see my life before, but you have to convince people who take decisions, who are decision makers, to actually you need to learn how to influence them and also to have a bigger voice for the public. So just want to mention that learning how to do that for me has been a very good learning experience during these last 2 years to make things happen.
Hi, thank you so much for the presentation. I think this is especially interesting for me and another colleague in the room because our program has a placements component where we go and work with organizations or researchers for a third term. And my placement is actually really similar to Mamás del Río that you described. It's just in a different setting. It's in Nigeria, but it's also fundamentally about like people who go and make interventions, like community health workers who go and make interventions in maternal health and immunization of young kids. I think when Bruno asked about social entrepreneurship, I thought it was like very interesting because it makes me realize that the organization that we work in is, well, fundamentally is a nonprofit. I think it's like mostly loss making in the arm that we're working with, but they also have a for-profit arm because the work that they do is very data driven. They do a lot of, you know, geospatial and like other kinds of like algorithmic work that helps, you know, these community workers target what village, what household. It's very dynamic and it's integrated with like a similar to yours, like a tablet device. But on the other hand, they use this capacity to, you know, do like you know, back end work, but also like UI UX for government as sort of like a contractor component. And exactly like you say, they have very good relationships with local governments. I think they handle a lot of contracts for not just immunization work, but a lot of other community engagement and health work. Which I don't know if this is like, I'm sure it's like a quite intuitive idea that you might have considered, but at least in the organization we're working with, it seems that they have an arm that does make money and an arm that makes the mission but actively loses money. And it seems to be sustainable. It's been around since 2019. So yeah, that's like an idea that I think we've been exposed to.
Yeah, thank you. I wish I can learn how to make money in a company. One of the things that I did was visit BRAC in Bangladesh. I don't know if you have heard about BRAC NGO.
Yeah.
It's wow. When I arrived to Bangladesh, it was super big. They have several enterprises. They have even a bank, a university.
Yeah.
And they do that. No, they make money, and they even sell jewelry. No, done by people from the community. That is great. Yes, it will be good to come up with something that give us money.
Magaly, compared to last year, you're now broadening into other services than maternal health, right? You're also into mental health and more sort of population health of the entire community. Are there certain services that the government does pay for example, immunization, that they would pay at least part of the infrastructure of the community health workers and the tablets and the costs you have?
You know, one of the biggest problems that we have is corruption. So, and political instability. We have had, during the last 12 years, like 7 presidents. And for me, it's very difficult to reach the government asking them for funding for these reasons. Once, when they explained me, they told me, no, I will commit, I will fund your program. And when I asked them, how are you going to fund them? I told them, okay, we're going to say that we're doing this. And with this, we're going to get the money to fund this. So we don't have a stable government and we have a lot of corruption. So for me, it's difficult, I mean, to ask the government to currently pay, because they will tell me that they don't have money. That's what they always tell them, even for the training of community health workers. They cannot do that. So, well, at the moment they did that, but it's just a period of time. It's not something sustainable. But yes, we work with them in some instances. We recently has done a health campaign, and they provided some medicine, some doctors, but it's like in specific points in time, not something regular, because there is not a plan. That's the problem. It has to be put in the budgetary segments so that it can be stable.
Yep. We have another intervention.
Hi, Magaly. Thank you very much for your presentation. That was really inspiring. I just wanted to ask about your plan with, I suppose, with political involvement and trying to pass laws around, well, what you said in terms of promoting the program. And what do you think is the end game, in the sense, if those laws were to be passed and the policies were to be accepted, does that help in terms of sustainability when it comes to funding, even if the government does accept it and you do succeed in terms of your political campaigns? What exactly is going to be achieved realistically? What do you expect?
So if we are able to change the law for community health workers, this means that by law, they can receive an incentive, which the Minister of Health doesn't want. That's why they have said no to the law that we're trying to push. But if it's accepted, then we will have the government to commit to give funding for community health workers, because there is no way to get sustainability if people are working for free, because sometimes if they get a job, they leave the space and becomes problematic. So one is the law. And the other one is push. We're on elections. So on April 12th, we have the presidential elections. By the way, we are in the Proven College of Physicians doing, it's where the candidates, a debate. We are doing a debate with the candidates. I am the moderator of the presidential debate. And we're going to listen their proposals in terms of health, because it's a health debate. So the idea is to push this and to put this in the agenda of the future elections. And also, but this is still not official, so please don't tell anyone. I am probably run as a deputy mayor for Lima in the next elections for the mayors that are in October. So I will run with Congresswoman Susel Paredes, who will end his term as a congresswoman in July. And I will apply as the number one, that is called the deputy mayor or teniente alcaldesa in Lima, which is a city with 11 million people. So it's like a country. And through that, of course, we will put, because I am in charge of making the health plan for our campaign, I will put, of course, the first point will be community health workers, because they are so important. And
Go ahead, Magaly.
And their party, the party of Susel, is Ahora Nación, who is the candidate who is on the 3rd place now. And we hope that he can go to the 2nd round. So that's because we will have, because no candidate, we have more than 50%. So we hope that he gets to the 2nd phase. And he believes in, I'm sure, if not through Susel, we will make him believe in community health workers. So, I mean, I think that's an important way to do political advocacy and making this a political priority.
This is a very nice way to end, Magaly, and to wish you good luck with the elections. I mean, I would say this is taking political activism to the supreme level, right? It's becoming a politician, which we hope you will be successful, and even more so that you can change, yeah, and get the changes you're aspiring to. And if I can get your commitment, even if you're elected, will you come back next year?
Of course, yes.
All right.
The political work is super hard, but yes, I will come back. You have to, you have to face several, I don't know what is the word, but insultos, like they gave you. I mean, also with TV, you know, when you have a political, like a statement, for example, with a TV segment on the impact of pregnancy in children. I mean, they have told me everything, like. And I won't repeat the words because, but yeah, you have to, I don't know, have a hard piece, hard skin, as you said. Yes.
Wonderful. I really thank you on behalf.
Thank you for the invitation, and don't forget to send me the pictures.
Yes, we will do that.
Okay, bye. Have a
Thank you
good
very
day.
much. Yeah, enjoy
Bye.
the rest of the day.
Thank you. Bye.
I really wanted to ask about the anacondas. As soon as I heard Amashi, I had to hold myself for fast.
Well, an inspiring story, right? I mean, the one thing that hopefully you take away is that people that work on something for 10 or 15 years, they're really passionate.
Mm.
And it's often related to something personal. People that pursue solutions for certain diseases, it may be because their child or one of their family members has that disease, and they just feel how awful it is, and they want to create a solution for that. Or they've witnessed something that they really touches their heart, and that gives them the drive and the passion to pursue this for 10, 15, 20 years, because that's how long it takes to get something from idea to impact. And I think Magaly is another example of somebody really passionate and taking to the extreme, right? Going for political office because people are frustrated that despite all the marches she's organizing, that these politicians don't act, which she feels very unjust. But also nice to end this module with the word corruption. So the HLMS week as well. So don't be naive. Yeah. People have different agendas, often personal agendas, not the one that you're trying to pursue, helping people. It may be helping themselves rather than helping others. So don't be naive when you take on these roles. Anyway, I hope you enjoyed the sessions. We'll hopefully have a good time next week as well. Do you have any questions on the presentations, or are we all fine for next week? Right. I'll see you by here. We'll see you next week. So I think you have another session at 4:15. Let's take a break of 15 minutes, stretch your leg. And it was what you can get conception, maybe, but so the other session.
Well, I was telling you that the only way you know about this because you're not being even if the money is not coming from yourself, the community so now you realize there's health, there's education, and there's license. Please stop saying the next question goes to the right when they even when they have their don't get the same security, they don't have to stay in the and then so that way they're getting jobs, they're getting outside of that. So that is the different business. Then they think about the business. I would form the business. The business. Now it's not. Some of them are useless. I think against. Okay. So now they